There's several things you can do about your smile. It depends on, what is not catching your eye. They always say beauty's in the eye of the beholder. So the first thing I'm going to do is I'm going to ask questions for you to kind of define what your smile is and then what you don't like about it. We can do some cosmetic dentistry. You can do veneers, bondings, something to change the shape of the tooth. If they don't like the color of their tooth or they want a little bit whiter, then you can make them whiter by just whitening the teeth. If they don't want to do whitening and they want something more permanent, then we go back into doing some cosmetic dentistry and doing veneers. We do a lot of veneers for those reasons. Is people don't like the shape or the color, and we change those for them. There's two types of veneers we do. We can do low prep or no prep veneers, and then you have to do traditional veneers. Traditional veneers, you just have to take about a ½ millimeter off the tooth structure. And then it's just this fine little film that we've taken off, and the tooth actually looks kind of the same, and people have actually gone without temporaries because they can look almost identical to their natural tooth. We have three predominant types of crowns. We have solid gold. It's not pure gold, it's a gold alloy, a mixture of metals, but appears gold. We have stainless steel looking, they look silver. We have what's called a porcelain fused to metal crown. Porcelain fused to metal crown is a little small coping of metal with porcelain stacked on top of it, so it looks tooth structure. Looks like a normal tooth structure. And the last one is all ceramics. We have an all ceramic crown that's just purely porcelain. Different styles of porcelain and different types of porcelain for different hardness and different purposes. Crowns last as long as the person takes care of them. Everything is dependent. God gave us a set of teeth that's supposed to last us our entire life, but we as human beings do things that we shouldn't. Chomp ice, chomp hard candy, put things in our mouth that we shouldn't. So as long as someone is brushing, flossing, and taking care of what they're doing in their mouth, they could last them forever. We have the good American Dental Association and Texas Dental Association that says we should tell people 7 to 15 years. It depends upon their habits. A temporary crown is something we put on the tooth that is in between the day we prep the tooth and then between the day we deliver the tooth. We do have the ability to do same-day crowns that don't require a temporary, but a temporary crown is the same structure as the patient's original tooth that we use to protect the tooth, keep the teeth from shifting and moving. The adjacent teeth will shift and tip in, and the top tooth will shift down. And the gum tissue, actually, patients really don't see this, and we see it all the time, is that if there's a piece of tooth structure missing, gum tissue wants to grow into that space. So it protects the tooth, keeps the teeth from shifting, and keeps the gums from overgrowing into the space where we're working. And it kind of has a sedative property in the cements that we use to temporarily cement it on. But it's just something to keep the tooth protected until we get the permanent crown in. Crowning today is in the same appointment as someone can come in. If we know ahead of time that we're doing it, because it takes a little bit more of a longer appointment time. It takes about an hour and a half to 2 hour appointment time. But what we do is we have the patient come in. We've diagnosed them already, so the appointment's nothing about the crown. We get the patient numb. We prep the tooth in a fashion that is required for an all ceramic crown. We digitally image the crown into a computer that has specific software that we can then go and design the crown. I can make a crown look exactly like the patient had. If the tooth is broken down, then I can make one look better than what they've had. A lot of people think once you have a crown or a filling in a tooth that it can no longer get a cavity. As long as bacteria can get to a tooth, it can cause a cavity. Cavities and periodontal diseases are caused by 2 different strains of bacteria. So as long as that bacteria can get at a tooth, or get it into a structure where they can do damage, they're going to do damage. They just can't do damage on the crown because it is not natural tooth structure. Dental implant is a solution for a missing tooth. So someone has either had to have a tooth extracted, it's broken, fractured beyond repair, and so now they have a vacant spot where they don't want to have a missing tooth. So a dental implant is a titanium root-like structure that you place in, bone heals around it, and then it acts and functions just like a root that we can then put a crown on, and so the whole thing acts and functions just like a natural tooth. Matter of fact, patients, once everything is complete, it feels like a natural tooth to them. Well, first thing we do is we got to make sure that we know where we're working. So we do an exam. We take what is called a CBCT x-ray. It's a cone beam x-ray. It's like a CAT scan for dentists. So we want to know if it's an upper tooth, we want to know where the sinuses are. We want to know how much bone we have on the top or bottom jaw. And then we need to know where we have a major nerve that runs through the center of our jaw that we want to make sure that we are staying away from. We need to stay away from 2 millers. Then that CBCT also lets us plan how to place it, where to place the dental implant. We take a digital image and we send the CBCT and the digital image to the implant manufacturer, and then we talk through having a surgical stent made or a surgical guide, and we want to stay away from the adjacent teeth by 2 millimeters on each side. We want to stay away from the nerve that's in the bone by 2 millimeters, and then we want to make sure that we have enough thickness and height of bone for that dental implant. And then we come back and we can able to deliver the implant through that surgical guide to the patient. It depends, because some people are missing just a few teeth. If you're missing just a few teeth in a row, you could do a dental implant bridge, supported bridge, which won't come out. Okay, it's permanently cemented in, acts and functions like normal teeth. People have to clean it just a little bit different than normal teeth. Whereas if you do something for that person, you might do a partial denture, just replacing the partially missing teeth, which comes in and out at will. And patients can take it in and out, clean it, and we typically tell them not to sleep in it at night and let the gum tissue heal. But you don't have to do that with dental implants. Then the other thing about dentures is you can do a implant supported dentures. Place a minimum of 2 dentures that denture will snap on, or you can place 4 implants on a upper or lower jaw, and then you can screw retain the denture on. The denture has a titanium core in it that you can't see. It's overlaid with gum colored material, and then that permanently, well, that screws in. We take it out. It's always recommended to take it out once a year to clean the implants. But so you can do a combination of both, implant supported only non-removable, or implant supported removable, or implant supported screw retained removable. So we have a lot of variations that we can do, and it's just driven on what the patient needs. On all-on-4 is where we place four implants in a jaw, either upper or lower, and then we create 2 sets of dentures. One set is a backup set of dentures, but they're the first set we use after placing the implant. So they're a little bit more forgiving, so that the patient, while their implants are healing, have a little bit more forgiving denture. Then after the implants have healed, then we go in and moving forward to replacing that temporary denture and backup denture with a more permanent denture. So then we're taking a specific impression or digital images, and we are creating a denture that has a titanium core that screws retain that denture onto the implants. Once that is made, then we can screw in the new permanent denture onto the 4 implants. And with that, then we close the holes, and then we have a screw retained denture that does not come out of the mouth of the patient. They don't have to remove it, and then the denture is in there, teeth are in there semi-permanently. We can take it out. Always advise to take it out once a year to clean the implants and make sure that the implants are staying stable and that the tissue underneath them is healthy.